When you are pregnant, then there are issues in the first 3 months that you may bleed a little bit more than if it is than in the other months. I mean, beyond the 3 months. So in the first 3 months, you can have some bleeding. Now, some of them are quite innocuous. They are not relevant, and it does not need any treatment. Some of them are definitely important, and you need to know as to which one is causing a sinister pathology. I mean, something which you will find that the bleeding is because of something like abortion or ectopic pregnancy and all. If we divide these types of bleeding, there will be general causes and the local causes. The local causes means the bleeding from the vagina, from the cervix, and the parts thereof, maybe due to some infection and some other reasons. And for the general causes, the most important part of this bleeding or important point is abortion or impending abortion, because in the first 3 months the chances of abortions are a little high. So if someone is now conceived, he will have abortion in around 15% of cases. That is the statistics that we see, somewhere to the tune of 15 to 18% of cases. That means if 100 people conceive in a month, 15 people will have abortion, because the ovum and the egg that are made to make the embryo are perhaps not genetically competent, and that's why the the babies, I mean the early pregnancies, they abort. There are different types of abortion. Some of them are, mild bleeding and they're off, so they will stop then. And some of them are like heavy bleeding along with pain. So what you need to understand is, like, if you have heavy bleeding along with pain, then you need to contact your doctor for him or her to see your gynecologist to see whether this abortion is of a very important cause, what we call as inevitable abortion or threatened abortion and things like that, or it is because of something which is not relevant but still there is some bleeding. Another important aspect of abortion and bleeding in early pregnancy is that what is happening to your pain, whether you are having severe pain and little bit of bleeding, that is because perhaps of ectopic pregnancy, where the pregnancy is not in the uterus where the pregnancy should have been, but it is in the tubes. So that is sinister. So you have little bleeding and more pain. So that goes to show that you may have ectopic pregnancy, and you have to, you know, report to your gynecologist as early as possible. If there is pain and bleeding simultaneously, that means more bleeding, along with it there is crampy abdominal, lower abdominal pain, so that may be a cause of abortion. So these are the two differences between ectopic pregnancy, where the bleeding is less but the pain is more. In abortion, the bleeding is more and the pain is less. That's how we diagnose or differentiate between these two pathologies, where whether the pregnancy is in the tubes or it is inside the utero and there is some bleeding. And now the bleeding can be of any severity, any degree. It could be, a teaspoonful of blood. It could be a cup full of blood. It could be more blood, blood with, you know passage of tissues, flesh, and other things. So whatever may be the cause, don't get upset or scared. Please contact your nearest hospital or nursing home or your gynecologist clinic, depending upon the time of the day and wherever you are. So that could be sorted. Mm, Otherwise, there could be local causes of bleeding like cervical erosion, some infection inside the cervix or the vagina, and that could be again seen through the speculum examination, which your gynecologist will do, and then they will, treat them accordingly. So that again is not a very difficult thing for them to do. The other thing, now we have been talking about the more sinister pathologies of bleeding in the early pregnancy. One is the bleeding because of abortion. Number two is bleeding, which is little less, along with severe pain in the abdomen, which you need to address to your gynecologist immediately, which is ectopic pregnancy. And the third, which is a very rare cause, which we call as molar pregnancy, where there are grape-like structures, which comes through, comes out through like abortion. Along with it, there is pain and bleeding. So these are the initial three causes of bleeding in the early parts of pregnancy, and also the local causes, as I have told. Now, there are some very minute bleedings which patients have. One, as we call, is as implantation bleeding, when there is pregnancy which has just now attached to the endometrial tissue, which is in the uterus, and there is little bit of bleeding, which is there is bleeding, but it is not significant, so it will not cause any harm. So that is all absolutely physiological. So you don't have to worry about that bleeding. And there could be some bleeding because of a silent abortion, like perhaps you have had a twin pregnancy and now one of them is expired, and that's why there is little bleeding, but the other pregnancy is doing fine. So in that case also you might find a little bleeding without much pain, because if there is severe pain, then the other pregnancy will also abort. Whether it will happen or not, that will depend upon nature and whatever prescriptions your doctor gives, or whatever treatment you are getting from your doctor thereafter. But these are other causes of bleeding which might occur in the early pregnancy. And in some of the cases, the placental tissue from where the baby gets its food and oxygen is low lying. The placenta is in the lower part of the uterus, and that might cause bleeding in the early pregnancy, and it keeps on bleeding in the in the first trimester, that is the first 3 months, and then also in the second trimester there could be bleeding, and thereafter. And then perhaps the placenta will remain in the same place, and we call it as placenta previa, where the placenta is low lying and remains like that. So you have to get yourself a cesarean section to get the baby out when the baby is matured. And in most of the cases, these pregnancies will be will be like more of a rest, and not doing any heavy work and things like that. But these are the very rare conditions where you will have to take absolute bed rest and things like that. But in most of the cases, the bleedings are like because of the abortion, because of the ectopic pregnancies, where the bleeding is less but the pain is more, and also because of one rare cause that I have got, molar pregnancy, where the pregnancies happen but it is an aberrant pregnancy, the blood values of beta HCGs or ACGs are high, but still the pregnancies will not survive. So that will have to be sorted out by your clinician or your gynecologist. I mean, these are in nutshell the types of bleeding that you get in early parts of your pregnancies. And of course, there are other causes, like if there is injury, there is a road traffic accident, and there is impact where the uterus is being, impacted between a seat of a car and things like that. So those again are rare causes of bleeding. The most important two or three important aspects of investigations for these bleedings, as you all know, one is the ultrasonography, another is some of the blood tests, of which important is the hemoglobin and also the blood group. So if your hemoglobin and other blood and hemoglobin, PCV, TCDC, they are all right, then we have to see the blood group. Because if you are having a negative blood group and you are having bleeding in pregnancy and the pregnancy continues, then you will have to have a injection because of your negativity of the blood group in that pregnancy. So that needs to be addressed as well. Early pregnancy bleeding in a Rh negative mother where the blood group is negative, will need some injections, as we call it. It is called anti-D, so that will need to be given if we are doing this. And of course, if we are doing DNE in a case of abortion, which is a blood group negative mother, like it, so in that case also, we'll have to give some anti-Ds. So that needs to be addressed. And then there is some of the cases where there is silent abortion, where we call it as missed abortion, where the pregnancy has grown up to certain stage and then it is not growing. You do an ultrasound scan today and then you repeat it after 7 days, and you find that there is no fetal heart, there is no growth of the fetus, and so on. So, in that case, you will have to have a suction evacuation or removal of the products of conception, because that pregnancy is not growing. Sometimes there is bleeding, and that is darkish bleeding in those cases, dark chocolate colored bleeding in those cases where there is missed abortion, as we call it. But sometimes there is no bleeding at all. You do only find it by doing a scan. And sometimes you also, what happens is you get a complete miscarriage, like you get a pregnancy, you do a urine test, and you feel the nausea, vomiting, and so on for 1 month or 1.5 months, and thereafter everything stops. And one fine day, fine morning, we go to the toilet and we find fleshy mass which has come out automatically, and there is little bit of bleeding. We do a scan, we find there is nothing. That means there is complete abortion of all the products of conception, because unfortunately the genetic materials were not right, the embryos were not proper, and naturally the body is now being able to throw it out, and that's why there is complete abortion, as we call it. So one is complete abortion, another is incomplete. The incomplete group will have heavy bleeding, and that needs to be sorted out by your gynecologist by doing a suction evacuation after doing an ultrasound scan. You can, if it is early weeks of pregnancy, we can do uh, you know medical management of those cases also, by giving some medicines, and then waiting, so that there is a type of heavy period, as we call it, mini labor heavy period, and then everything goes out and the bleeding stops thereafter. You may be treated with some medicines in those cases, and iron tablets, and so on and so forth. So this, in short, is all that you need to know about, bleeding in early months of pregnancy. I know there is a lot of worry associated, and there is a lot of anxiety and fear associated with bleeding in the early parts of pregnancy. But not all of them are bad, and obviously there are some which are bad. And you have to remember that not all pregnancies will go till 9 months and then will deliver a healthy baby. Some of the pregnancies are not very good to start with, so they will, in the first 3 months of pregnancy, tend to miscarry, and you get a abortion for that. But there is no reason for you to worry, because there is always a second chance, always a third chance. So you can go ahead and get yourself checked with the doctor, and he or she will advise as to how you can be treated accordingly. So, this much knowledge, perhaps, in the background, and I am open to any questions that you may ask. If you want to write something or ask, then perhaps I can answer your queries, if that be so. This question is, I'll read it out. What problems with placenta can cause bleeding during pregnancies? And the next part of the question is, can bleeding be a sign of preterm labor? Yes, I mean, in later part of pregnancy, when the pregnancy is advanced, then bleeding could be a sign of preterm labor. And problems of placenta are twofold. First, because we are discussing early pregnancy, so we are not discussing the late effects of placenta. But anyway, placenta are of two folds. One is normally localized placenta, where the placenta is above and the baby is below, and so that if there is bleeding in that placenta or behind that placenta, then that could trickle down, and that is called antepartum hemorrhage because of um, this APH. But otherwise, it is because of the placenta previa, where the placenta is low lying and there is certain amount of bleeding. And obviously, there could be problems of preterm labor, like deliveries at around 22 weeks, 24 weeks, 26 weeks, if the bleeding continues in pregnancy. That needs to be addressed. And that's why we are talking about medicines and rest and other things. If the placenta is low or if there is this thing. I mean, this we have already discussed. What problems can cause bleeding during early pregnancy? So, just to summarize, one is your abortion, which could be a missed abortion or a threatened abortion, where the pregnancy is threatening that it will come out, or it could be complete or incomplete abortion. Complete abortion, where the os of the cervix has opened and everything has gone out, and incomplete abortion is some part of the pregnancy is still inside the uterus, and that's why there is heavy bleeding. So you need to contact your doctor. So these are the abortions that we are talking about, and of course I have talked about ectopic pregnancy, where there is little bleeding but more pain, much more pain, and you might faint because of pain inside. There is bleeding, but in the bleeding is more inside your tummy. It's inside your abdomen. That's why you get severe pain. Well, this question is there. It's not relevant in this context, but I'll tell you your signs that you are going into labor. Remember four things about in the last part of your pregnancy. That is your homework from all of your gynecologists. One is you can have a little show. You can have a little bleeding in the last part of your pregnancy, say 37, 38, 39 weeks, which means that you are starting to labor. So little bleeding at 37, 38, 39 weeks, which is called SHOW, SHOW, is a sign of early part of labor starting. Second is your pain which comes from your back and goes into your tummy in front. So pain from the back to front, and it is gradually increasing in intensity. So the next part is the pain. So this is the typical pain that I'm talking about. It's not a niggly pain here, there, and on the right side, on the left side, and so many other places. So that is not the pain I'm talking about. It's a typical pain which comes from your back and goes in front. From your back, it goes in front, and gradually intensity of the pain increases. The time duration for which the pain stays increases. So second is pain. One is bleeding, little bleeding, or second is pain. Third is your breakage of water. If if the water bag breaks, then there will be dripping this fluid inside the around the baby. It comes out and it drips through your legs, and it will drain your all clothes and all. So that is the third sign. So if these are the three signs which shows that you are going into labor, and you must contact your hospital or clinic or doctor immediately. And of course, there is other thing which is not associated with labor, but if there is less movement of your baby. So if in the last 12 hours the baby movement is less and you feel that you are not satisfied with the movement of the baby, then you go ahead and check with your physician or the clinician as to baby is all right or not. But that has got nothing to do with your labor. you are in your late pregnancy and experience little bleeding, what could be the problem? Number one, I have told that it could be because the placenta is low lying and there is bleeding. It could also be because of the show that I am talking about, that means the starting point of early part of labor, or it could be a local cause that I was discussing in the early part of our discussion, that there could be local cause, some cervical infection, and so on and so forth. So all these things could be a cause of little bit of bleeding in the late part of your pregnancy. What should I do if I have miscarried? I mean, as I've said, around 15% of conceptions they will miscarry. So don't worry. Go ahead and try the next time around, say around 2 3 months thereafter. Uh, See if you are conceiving naturally. Do the healthy things before you contemplate your pregnancy next time around if you have miscarried. Like, if you are overweight, then you reduce your weight. If you are smoking, then you stop smoking. If you are taking any medicines which are not good for the pregnancies, ask your doctors and stop them if possible. And of course, you take some folic acid tablets, which we have discussed in a previous uh, discussion at this forum, folic acid and pregnancies, which we have discussed. So you take folic acid tablets at least 3 months before pregnancies, 2 to 3 months before pregnancies. And if there is any other disease that you are suffering from, say for example diabetes, then you control your blood sugar and get into pregnancy. If you are overweight, you reduce your weight and get into pregnancy. And if you have got thyroid problems, you reduce your thyroid, take all your medicines and get into pregnancy. In all likelihood, you will have a normal conception thereafter. I mean, there is high chance that in the next time around, you will get a normal baby. What is an ectopic pregnancy? Pregnancies in the tubes. You know, usually the pregnancies are in the uterus. Uterus is a muscular body and it is very expandable, like a rubber band. So if you put a pregnancy inside the uterus, it will gradually increase because the baby will increase and the uterus will also expand and it will accommodate the baby. But if the same pregnancy goes ahead and go get into the tubes, and the tubes are very thin, the muscle structures inside the tubes are very thin, and that is the reason that when the pregnancies grow, the tubes will burst because there is no space. That's why that is sinister, that is bad. So you need to contact your gynecologist immediately and get yourself sorted, operated, and let them do whatever they want to do with this pregnancy. Obviously, that pregnancy is also a type of miscarriage, but it's not going to go full term. So, ectopic pregnancies need to be addressed immediately. It's not like that you have diagnosed ectopic and you are sitting back at home. So, if there is any query about severe pain abdomen and you are pregnant, then go ahead and immediately discuss your query with your doctor or a clinic or a hospital or a nursing home, wherever you are. Takeaway message from this is, as I've said, ectopic pregnancy is a sinister condition where you might end up, getting operated, blood transfused, and so on and so forth, losing one tube, which is a stormy, you know, event of pregnancy. Be careful that if you suffer from such, then you contact your doctors immediately. That is one thing. If there is little bleeding in pregnancy, don't get worried, but in the first instance, you go ahead and contact your doctor to see whether he can, give you some medicine so that this bleeding stops, or he can order for a scan ultrasound to see what is happening for the pregnancy inside, and some medicines that you will suggest. A lot of people ask about, whether I should take absolute bed rest and things like that. I don't think bed rest helps much, but obviously you will not be doing a very heavy walk, but little walk at your home, and you can move around, go up and down stairs and do your home household work. You can do your office work, sitting at a place, and things like that. So, no need to worry if there is a little bleeding, as long as your doctor reassures you, does a ultrasound scan, and gives you medicine, and you are taking them routinely. And let's hope for the best. Okay, so we call it a day. Thank you very much, and hope you had a nice learning session. And any further queries in future, we'll be more than happy to answer all. Thanks.